My name is Lisa Locken. I'm co-presenting with Alan Cooper and Madison Fueling from Mansilla Partners. So I think I'll let Alan get started with his part of the presentation. We're talking today about promoting human milk feeding, as well as a few other things for PeriData.net.
Thanks, Lisa. So essentially, brief and focused agenda to kind of take advantage of this time. We just want to kind of provide a little bit of a quick update on the PeriData.net on some of the things that are either being released or have been released. And then Lisa will be able to give a demo on the new WSPIC fields and the measures that are inside of PeriData, as well as the reports, and then open it up for questions. So we'll get started on kind of the quick updates that are coming soon. The first item is the data dictionary reports. We already have the ability for users to actually look at the data dictionary inside of PeriData itself. It's its own little module, if you will. And those that are kind of familiar with it already are probably use it. And it just gives, to those that don't even know what a data dictionary is, essentially, this is the way that we communicate a definition for each of the data elements inside of PeriData that you enter information in for birth record. It gives kind of a definition, what are the data elements or values that can be entered for any given field. And to kind of help out the user group, we also created a report for this inside of Pentaho with a few different flavors of that report. Just because we know that some people like to look at information a little bit differently, we have a few different offerings. One of the offerings essentially is an Excel report where you can download it, and they actually have it where it's tabular, so each tab represents what we'd call like a navigation item inside of PeriData. You also have it in a PDF format as well, where it has a table of contents, where you can click on the table of contents and, again, aligned with the tabs on the navigation. They'll allow you to get to the area that has the particular field that you have questions on. Each has their benefits. The nice thing about the Excel is you can actually go into the field itself and do a quick search. You can do this PDF as well to look for the field that you're trying to look for. We also have a filtered version of this report where inside of Pentaho, where you're going to try to narrow down the actual section, navigation, and then a section inside navigation to try to isolate the fields that you care about. So again, just trying to give the ability for exposing the data dictionary in a way that might be more useful for everyone. The other item we want to talk a little bit about is the future moving forward. After we kind of met the data committee last month, one of the topics was releasing new data elements and required fields inside of PeriData. It's been a little choppy in the last year or so in terms of introducing new fields. A lot of it's been driven on just requirements from the Joint Commission, require new fields, or requiring existing fields to be required that weren't before, or just new projects, whether it's WSPIC or and the like, that require certain fields for these measures. And the choppiness really is that sometimes we release these fields in a fashion that's not very timely for hospitals to actually adjust their process, enter these fields in. So moving forward, we're gonna change that a little bit, where we're gonna release new fields, hopefully on a quarterly basis, and required fields on a quarterly basis, meaning, hopefully either January or April or et cetera, any given year, we will try to follow a schedule. And at a bare minimum, we're going to at least give each hospital a month notice that these new fields will be available. So this particular topic today with the human milk feeding, there are some new measures that require new fields that we're going to release, in fact, the next day or so, that will be required starting January 1st of 2017. So we just want to give everyone an update on that process, and hopefully that helps everyone in the future in terms of how to adjust their process. Another thing to help out people in terms of helping complete their data is we're going to try to introduce some new filters on the left-hand nav, similar to what the hospital complete or hospital incomplete, state complete, etc. We're going to try and introduce kind of a sub-filter of the hospital complete status or incomplete status, and kind of isolated by project. So then if you're kind of focused on, do I have all the fields required for WHA reports or checkpoint summary, you can look at that filter and really determine which birth records still need to be attended to be able to complete them. Same goes with a new project with WISPIC or HIV. So trying to subset these out a little bit so to help out the users complete the required fields. Finally is the infant data discharge pending field. This is a new field that we created mainly because of the updates we did with the early elected delivery report and the child complicate or the what is that one report called? The infant complication report that is submitted to Checkpoint. And previously, we've been using the mother's discharge date as the discharge date, and what that date really does is it determines whether that birth should be in this quarter or the previous quarter, and that's the date that kind of determines that. Beginning probably either Q4 of this year or Q1 of 2017, the infant discharge date will actually be the date used. Now, what we've learned through talking to the data committee is that sometimes the infant is obviously transferred to a NICU or just is prolonged in staying in the hospital that may go past and beyond the typical timeline of actually putting information into PeriData. So in the meantime, what we're encouraging people to do is click on this new field called just, infant date of discharge pending field, which is right near the infant date of discharge, as kind of a short-term click where, until they know when the infant's actually discharged, it at least will display as if the hospital complete status is confirmed as done. However, when we submit the actual data for Checkpoint on a quarterly basis, they will not be included until that date is actually filled in. So we are actually creating a new report, which hopefully will be released in the next week or so, that it's like an exception report that will highlight all of the births that do not have an infant discharge date, so then you can be able to actually work that list and shrink it down so then those births can be included in future reports. So anyway, that's all the updates I have for now. We can open up questions at the end after the demo from Lisa, but I will pass on to Lisa to do the demo.
Oh. Okay, show my screen. Hopefully you guys are seeing the PeriData Net screen. A couple of things that I'd like to go over. As Alan mentioned, we're trying to get ahead of the game on things that we build so that they're ready in time for projects that are going on. We're really excited that in 2017, the Wisconsin Perinatal Quality Collaborative has selected promoting human milk feeding. There are a number of pieces to the puzzle for this collaborative effort, one of which is in the PeriData Net system, which I'll be mainly focusing on today, but I did want to give you some more information about the general project for those hospitals that are going to be participating. First of all, we're going to do a number of things in PeriData Net. One of the things I'm really excited about is that we are moving toward incorporating more quality improvement efforts into the system. This allows for consistent calculation and comparison. You don't have to do it by hand yourself as long as you can get the data into here. And what else we're doing is building in some quality improvement features. So for example, if we're not maybe hitting the target of what WISPIC had set for, say, skin to skin, we might be able, by seeing different time frames and so forth, take a look at where we can make some improvements and kind of move the dial that way. So what I'd like to do is show you a number of different things about this Promoting Human Milk Feeding project. First of all, I'll go through what the different measures are that WISPIC is going to use. The first one is a prenatal education one, where women taught on the importance of human milk feeding. This, of course, is probably going to be handled in offices and clinics and so forth, and not really germane to PeriData.net, but it is one of the measures that will be out there. Then we have a couple of skin-to-skins. A couple of these are still being fine-tuned by the WISPIC data group. But the first one is the number of babies that were put immediately skin-to-skin right after birth. Now, the exclusions that we're using is babies that go into the NICU, moms who were sick, babies who are being adopted out, and that type of thing. So essentially healthy term newborns going immediately skin-to-skin. The sub-point to this one is babies who had various procedures such as their eye ointment, vital signs, those types, maybe a blood sugar testing that was done skin-to-skin in that first hour of life. That's a sort of a sub-measure of it. We also have a couple of more things that are pertinent to promoting breast milk feeding, one of which is rooming in. Baby Friendly talks about the babies being in with their mom 23 hours or more per day, so we're going to be taking a look at that for term kids as well. We're also going to continue to use PCO5 and PCO5A from Joint Commission as far as supplementation goes. And then we're also, to be able to capture all babies, not just healthy term kiddos, is in moms and babies who are separated from their infants, are we getting them to pump after the separation occurs, preferably within 6 hours of that separation. So those are all hospital measures. And then these last two, as you can see, are human milk feeding after discharge and exclusive human milk feeding after discharge at periodic month intervals throughout the baby's life. So this will allow follow-up, whether it's at WIC clinics, public health, offices, etc., to be able to look at it in those manners. So those are kind of the measures that were used. And so now let's look at in PeriData.net itself, where we are going to have these things. If I go into a record, all of the sections for this are going to be found under other postpartum or neonatal information, which is already where you find the information on the baby's feeding. Believe it or not, while this looks pretty small, it took a while to get this information together. But we've got, under the feeding, we've got two new sections. One is skin-to-skin with infant, and one is mother-baby interaction. So I'm going to show you what each of these is and kind of go through what it means. The skin-to-skin initiation after birth has a couple things. Yes, they went immediately after birth. Yes, but not immediately after. No, and unknown. So again, what the one that's going to be most fitting for the measure will be that immediately after birth. But you know, sometimes it isn't possible right away. And again, from a quality perspective, you could take a look at are we at least making some strides in the right direction. You will notice, just like with all the other places, that there is a definition of what each of these things is supposed to mean. So again, this is the timing of the contact with the baby or family member after birth. So you select which one's appropriate. If I were to pick a no, it closes down the duration of time and the assessment being done because, of course, it wasn't happening. But if I say, for example, yes, then I don't get the reason for separation. So let's take a look at each of these. If I had yes, but not immediately, I can go on to say why didn't we have them go immediately skin to skin? And then there's a variety of other choices here. Maybe the baby's not medically stable, mom's not medically stable, mom just didn't want to do it or didn't have any interest in doing it. It could be that it's on us. As clinicians, we didn't offer it, or again, we always have the option of unknown. I will say with these medically unstable, the list could go on and on as to what that is or is not. I think the best thing we're going to be able to say to all of our participants is, within your own organization, pick how you are going to define it. And let's not get crazy with every little thing, but when they are actually unstable, either mom or baby, that we go ahead and mark that. So that's what that is for. Now the duration, again, for the purposes of the measure, we would like immediately skin to skin and 60 minutes or more. But again, this is a great QI thing because maybe we're at least working on it, but aren't all the way there. So we do have these other time frames here that are under 60 minutes, but that at least allow you to be able to mark where the baby fits for this. And then finally, under this section, newborn procedures and assessments done skin to skin. That's just a straight up yes, no, or unknown. And the definition here is, again, were procedures such as vitals, that blood glucose testing, or med administration that were happening in that first hour, are they done with the infant still placed skin to skin? So that's the whole skin to skin section. So I can mark a few other things on here. And then we can move on to mom-baby interaction. So this was throughout the baby's hospital stay. At any time during the stay, what was going on with them. We did default maternal-newborn separation to no, because for most of our babies and moms, they are not separated, meaning the baby and mom go to like a mom-baby type of a unit. There will be the option, obviously, if they're going into the NICU, that we change this over to a yes. So rooming in at least 23 hours per day. We do have a number of choices for this. We're just marking yes or no straight up on this one. So did they room together throughout the hospital stay? They may have left the room for a short period, but usually under an hour. So perhaps the baby was out for a circumcision, or mom decided to take a quick shower or something and wanted the baby washed elsewhere. Those type of things did not count. But if she did not have the baby in there for 23 hours or more, we're going to say, why not? And with this, there's a number of choices. This would be similar to what I was mentioning before. Each facility needs to begin to operationally define what they're going to count in this section or not. Diminished responsiveness to infant cues was a set of terminology that the collaborative talked about. For example, women who are heavily sedated or that type of thing and would be not safe to have the baby in with them, that's what you would mark there. Baby friendly often uses the thing about, did they at least remain together during the day, but maybe they did not room together at night. That's a choice that they have if you're marking no. So we have that one in there. And then we also have medical reasons for why they might have been separated. Again, maybe the mom was physically not able to. Maybe she's in the ICU or had a stay in labor and delivery for a prolonged period of time. Maybe it's a medical reason for the baby. They're in a NICU or special care nursery, or they have some other kind of treatment going on that cannot be done in with mom. And then there's the maternal refusal, where it's her choice not to have the baby in with her. Then this separation one, were they separated or not? And this is more for a prolonged separation due to a medical condition, one or the other. So this is more about a care reason, not because, well, they're both on mom-baby together and they just want to not room together. So if there was separation, it opens up this other thing maternal pumping or manual expression. And the deal with this is if they are separated, did she start either pumping or manually expressing once the separation occurred? And we would say yes. If she did start pumping, no, but she did plan to breastfeed. This other one for no, plans to formula feed, is to kind of weed out the ones who were not intending to nurse the baby or feed human milk anyway, and then unknown. So on this one, if I go ahead and say yes, then we have the time of first pump or expression after separation. And for this one, we're trying to figure out what timing did that occur in. Any one of these shorter ones will count for the WISPIC measure. If it's more than 7 hours, at least they got going, but it will not count. So these are the fields that are in there at present. I also wanted to show you, just as a reference, because Alan mentioned it before, what if you wanting to use the data dictionary? Those same definitions, even if you're not in a particular record, can be found down here under data dictionary. And when I open that up, I can go to other postpartum or neonatal information, and you can see that each one of these things is in here. And let's take a look at this one. For the separation, again, it gives that whole definition, same as we saw in there, but I wanted to point out it's usually considered enough time to have missed an infant feeding, such as 4 to 6 hours, and does not include periods of time where mom is choosing not to room together. So hopefully that helps to identify for people when they would count the separation. So I think I should see now, are there any, here, questions? Is this voluntary for hospitals? Are they flagged for completion if you don't fill in the data? This information is voluntary for hospitals. I think it's going to wind up with a flag. Alan, are you able to comment on how the flagging might happen for this one?
Yeah, I mean, essentially, this will be no different than how we treat the other WISPIC measures. That, I mean, it doesn't affect what's submitted to WHA checkpoint summary. It just affects that when we you have the measures that relate to WISPIC projects, they obviously won't be a part of that if you don't complete the fields. And this kind of relates to those new filters that I mentioned previously, where to help kind of some of the hospitals that choose or just aren't able to participate in some of these other programs, such as these measures, you know, introducing those other filters, WHA filter as an example, will help you at least understand what fields are completed for whatever initiative that you choose to participate in.
Okay, thank you, Alan. So yes, this stuff is voluntary, but I do believe that if it's something that many organizations are looking at, again, it's a great place to go ahead and put it for sort of one-stop shopping, if you will, so that we have that readily available, and then again, the data can be sort of sliced and diced, if you will, in a consistent manner, and that someone else isn't having to come and take all the data collection, put it into some other thing, and figure something out on their own. So it's a way to do it, to have somebody else do all the behind-the-scenes work on it. So good question. I'm going to jump over into the Penn Tahoe side and show what this is beginning to look like on the WISPIC summary report. For those of you who've been involved in it, and I think I have this in a bigger form here, we started out with all the hypertension, and that will still be at the top of this summary report. So if you're doing things with hypertension, that's on the first page and a half here, up through the NICU admissions. Then skin to skin with infant is where we're starting the human milk feeding part of the report. And again, this is very preliminary here as to what it looks like. But what we're doing then is looking at, this is skin to skin immediately after birth. Each one of these sections then is divided into 3 parts. For all the babies that would qualify, all deliveries. Then the next one is for vaginal deliveries, and the next one is for cesarean. And as you can imagine, especially when you're doing quality improvement work, there's probably going to be some patients and some types of deliveries where you probably have low-hanging fruit that you can work on at a more rapid pace, and other things that might take longer. So for example, if you have logistic issues around getting babies skin to skin immediately in a cesarean, maybe you at least see, well, how are we doing with our vaginal deliveries? Let's bump that up while we try working on C-sections. So that's how all these are laid out in here. And we also have, even though this number here would be the one that is going to apply directly to the WISPIC thing of, did at least 90% of your kids get skin to skin for at least 60 minutes immediately after birth, you've got these other ones that can help you along. So over here, this part's not an official thing that those participating in that project would necessarily report in, but they can look at, well, hey, we didn't do it immediately, but look at what our percentage is for the ones we actually got on at least a little bit later. And again, we got fake data in here, so that's why it's looking like it is. And then this last part on here is for the procedures or assessments. So that's, did we do skin to skin while we were doing the vital signs and that type of thing. You will note that we're excluding kids that are placed for adoption, obviously any deaths, NICU admissions, kids who weren't stable or moms not stable. And then we also did add in, as a de facto kind of thing, maternal ICU admission. So if you did have a mom who went down there, she's going to be excluded from here. The other thing I'd like to point out, for all these WISPIC things, we are using the infant's date of discharge as sort of a trigger for what date we're measuring here. So keep that in mind, that in order to have the thing calculate out, the baby's date of discharge does need to be in there. So that's similar to what Alan was talking about with those pending discharge dates. Any kids that are pended won't be on here. Once you actually put a final date of discharge, then they will factor into these total numbers. My third page on here then is rooming in or rooming together for at least 23 hours per day. And again, you can see what is excluded. Those are the ones if I had the diminished responsiveness and that type of a thing. And again, the 3 types, all deliveries, vaginal and cesarean. Then pumping, same type of a thing. And here we are excluding plans to formula feed, at least at this time, unless the data group says differently. And then just for comparison, we also do have the exclusive breast milk feeding, as I mentioned before. We add over to here, this stuff is also like on any number of other ones of our reports. The exclusive breast milk feeding, the PCO5 from Joint Commission, as well as the one indicating mom's plan to feed. So again, from a quality perspective, you could start using some of this information to see where am I at least with those women who were in fact planning on providing exclusive breast milk. So that's kind of what that report looks like. We will also, like we do for everything else, have what we call a patient level report of an Excel thing that goes and lists every single patient, and whether they're in numerator, denominator, that type of thing. You can go look at that to find out, gee, are we missing certain fields or so on, or gee, why is this person falling out? You can get their record number and go back into your records to find out why in fact they're falling out. So that's kind of the quick run through of the different pieces to this. And I'll look again to see if there are. Ann and Alan, have you been able to pay attention to some of these questions here?
Yeah, I answered one already. I assigned 2 to you if you want to look at those.
Oh yeah, you assigned them to me? That means that I have the technology to get back to them. I think while we're at it, well, we may need to see my screen again some more, huh? Okay, here comes some questions. Oh, the question is, you know, does this penalize baby if you're not baby friendly? I think the idea is this isn't, the information we're using this for is to help for your own quality improvement efforts. It's not intended to be reported out somewhere that it is going to either be something that becomes public record or gets paid for performance. The issue around rooming together, around reducing any other type of separation, around building up a milk supply as soon as there is separation, all of those things are solid ways of promoting breast milk production and better breast milk feeding, and so that's why those were chosen. They are very similar to baby friendly, but that doesn't mean that one has to be baby friendly or so forth in order to participate. Let's see, are you reporting any of this directly to Joint Commission? No, other than PCO. Actually, we are not posting anything directly to Joint Commission at this time, Alan, correct? We're not actually technically a vendor.
Yeah, I mean, basically anything that is Joint Commission related is really just related to WHA's checkpoint, and you know, we just send it to them. But this has nothing to do with any of these measures that we're talking about today.
And then my understanding is whether you're participating or not, any filters that Ancilla will produce for PeriData Net are on there for anyone to use. Is that correct, Alan?
Yeah, the goal is, it's not completed yet, but our goal is to create these additional filters to help groups that are, you know, aren't unable to participate in the WSPIC type of measures, but they really just want to make sure that their checkpoint stuff is completed. That's what these filters are hoping to achieve. At this point, because of initiatives like this are available and growing, you know, there's only so many things we can put on a screen to help with this whole required concept, because the required definition really just means that if you want the data elements to be related to any measures that are being produced inside of PeriData, you know, that's kind of the whole point of those required fields. And if we can kind of have a filter to help people navigate to look at the records that they care about for their own initiatives, that will help achieve this.
Right, so as Alan's pointing out, what we want to move toward in the future is perhaps different terminology, meaning report required versus required for a mandatory thing that's getting exported out. Would you say so, Alan?
Exactly right.
Right. So again, if I want to have something come up that's got accurate information or data in here that I can be assured includes all the babies I thought it should, etc. in here, then that's what it required in that sense would mean, is all the elements are filled out that allow for the appropriate calculation to occur in the report that I'm currently looking at. So that's one of the things that we'll be taking a look at. I also see another thing in there with the skin-to-skin that the data group and the collaborative may need to take a look at is with regard to the skin-to-skin for procedures or assessments. What if we completely deferred those till after nursing and so forth had occurred? So we may need to take a look at something where this one might not even apply at all just because we didn't do anything during that time frame. So that is something that we'll have to bring back to the group. Let's see. I think that's about all the questions that I see on there right now. I did want to mention, for those who are interested, the Wisconsin Perinatal Quality Collaborative will be hosting a webinar on Friday, December 16th at 11 a.m. And that's for those who are interested in participating in one or more pieces of data collection related to the human milk feeding improvement project throughout the state. And Ann, do you have more commentary on that?
Hi, this is Ann Conway. I've been listening to the discussion and looking at the questions, and I think first to back up a bit, Lisa, the whole breast milk feeding quality initiative is part of the Wisconsin Perinatal Quality Collaborative. So we are working in conjunction with Ancilla and PeriData Net to make it easy for hospitals to collect information. It's I think there's some confusion as to whether or not this is required or not required. It is optional. If you are interested in being part of the initiative, you should let us know. You probably got an email recently from Jenny Jerome from our office. If you're interested in participating in the initiative, let us know. You can either email Jenny or Kyle Mounts, or you can email wispic@perinatalweb.org. And the webinar on December 16th will focus on those who are interested in being part of the initiative and what data they might be interested in collecting. And the first thing that an organization or hospital would do is look at where they think they need to improve or where they want to improve, and then choose whatever areas of improvement are measures that they think would help their particular institution. And then on the 16th, we'll talk much more about not only how you enter the data in PeriData, but if you're in an outpatient setting and you're doing prenatal care, or if you're in on the other end of the perinatal continuum and taking care of infants after discharge and looking at how long they are breastfeeding. So we'll have other ways for you to submit data, other ways for you to collect data. So the 16th will be some reinforcement of what you just heard this morning, and then additional data collection techniques.
Okay. Thanks, Ann. But again, to remind you, since this is a PeriData.net call, this is an enhancement in order to allow folks that many of which are already collecting a lot of this information, a good, easy place to do it, a good, easy place to begin to take a look at their data and where they want to make improvements. And again, whether it's baby friendly, whether it's A1, etc., these are at least processes that help to promote the feeding. I would also like to point out that where I work directly with, I've got one baby-friendly hospital and one that is not. That being said, our nurses have a number of QI initiatives going on right now around things such as skin-to-skin, and I think that this is going to be a good adjunct, or actually almost a better way for them to go ahead and take what they're already doing, be able to have it entered into here, and then be able to go on and use the information that we pull out of here to see where they are making improvements, where they still need to work on, and that type of a thing. So I think it is going to be just very beneficial for a lot of the quality improvement work that I think particularly nurses are doing around the state of Wisconsin, at least on the hospital side of things. Are there any other comments or questions here? We set aside a full hour. That does not mean we need to take a full hour, but we do want to make sure that this stuff is making sense to you, and that you know where to find it, to look for it when it does come out, and that you know that starting the 1st of January is when it would sort of be fully ready to go, at least from the data collection side of it. Even though Alan's going to release some of this stuff into production sooner than that. It gives you time to look internally for how you are going to manage it for your own organization.
Seems like there's one more other question. What do we hospitals need to do if our hospital does not want to do the WISPIC to receive the filters? It isn't something you have to ask for. We just are aware that we need to do these type of things to help out organizations that may not be able to participate. So it isn't something you have to request. It's just something we're going to try to build this month to help you guys out.
Right. And again, we do work in conjunction with a number of other projects that are going on. On the flip side, again, as representing the WAPC Perinatal Data Committee, again, we want to be able to put in fields that are meaningful and useful for you to capture information that helps you to better understand what's going on with your patients. So clearly, if there are other types of things that may be beneficial for the care of our moms and babies, we'd be very interested in entertaining what those might be as we move forward.
Two other questions came about, and they're more probably directed to you. When is the webinar on the 16th again?
Okay. That's on...
Oh, sorry, go ahead, Lynn.
It's 11 a.m. to noon on Friday, December 16th.
And people should register ahead of time for it. There is no fee, but they should register.
And then the other question is, can you repeat the email if you want to participate in the initiative?
Yes, you can send it to Mounts, MOUNTS, at perinatalweb.org.
Okay. And that looks like that's about all the questions that we have at this time. I thank you all very much for participating in this webinar, and hopefully you found it informative and you can take the information back to the appropriate people in your organization, both for data entry and for data usage, to determine what will be the best ways for you to utilize this information. Again, on behalf of WAPC, WISPIC, and Ancilla, we thank you for taking time out of your day for this program. Thank you.